That is Dr. Prashant BPD. Basically, I have done my graduation from School of Allied Health Science, Sharda University, and my graduation done on 2015. And already done, I was also the faculty in the Sharda Hospital. And after that, I joined the B.Sc Healthcare Limited, which is posted in the Bangalore. And then after that, I came back to the Delhi, which joined the Max Hospital, Vaishali. I was just senior consultant in the Vaishali, Patparganj, and the Max Noida. And first of all, before I'm starting the things, I just like to thanks to everyone, especially Dr. Kapil sir, Dr. Supriya ma'am, for giving me the opportunity for all those things, and of course, Dr. Bhavna Sharma. Thank you so much for sharing all the things. Our college journey was tremendous. I have learned so much things and giving you the presentation and sharing the topics of the COVID-19 because of these guys. Thank you so much, sir, ma'am, and everybody who has given us the opportunity for these things. So now we are starting the COVID-19 things. The role of physiotherapy in what is the role of physiotherapy in COVID-19? What we will do in the COVID-19? Before we are going to the treatment protocol, first time we have to know what is a COVID-19. First of all, if you will go for the COVID-19, first of all, it comes in the mind, what is COVID-19? What COVID stands for? What is the full form of COVID? Why it's called the COVID? The COVID stands for coronavirus infected droplets. This is called the COVID-19 because it comes in lighting in 2019 November. That is called the 19. So COVID stands for coronavirus droplets, infected droplets, which is lighting in 2019. That is called COVID-19 in the Wuhan, China. It's also known as SARS, that is a severe acute respiratory syndrome. Because first of all, we should know what is syndrome. Syndrome is a collection of the symptoms. Then it's called comes in syndrome. Symptoms is lots of symptoms. I will tell you what is the sign and symptoms of the COVID-19. And the another name of COVID-19 is MERS, Middle East Respiratory Syndrome. Because it's in the Middle East, that's why it's called the MERS, Middle East Respiratory Syndrome. And definitely we already know what is the cause of this COVID-19, that is a coronavirus. Still, it's unknown to why it comes from. Somebody tells it comes from the bat, somebody tells biological weapon from the China, but nobody knows. Still on investigation by all of the country. So after that, though knowing about the what is the COVID-19, we should know after some person with infected with the COVID-19. So what is a sign and symptoms? कि आपको ये COVID-19 हो गया, you are suffering from the COVID-19. What is the sign and symptoms for the COVID-19? How do you diagnose this is a COVID-19 or not? So first of all, the first symptom is high grade fever for the persistent 5 to 6 days. Some person who is affected with the COVID-19 is persistent for the high grade fever is more than the 99 to the 106 Fahrenheit. In between this fever, something happened for the persistent 5 to 6 days. Then the first thing is strike maybe chances of the COVID-19. The next symptoms is cough with sputum, with chest pain. Some patients having complaint of I'm having cough and the secretions of the sputum with the chest pain. Of course, while in coughing something or sneezing something, the chest pain occurred. But now the scenario comes, some patients don't have symptoms, they don't have coughing things, they don't have sputums, but they continue coughing the things but don't spread the sputums after that. This is another symptoms for the COVID-19. The next is tiredness of the body. We tired early as soon as before we are starting the things. हम जल्दी थक जाते हैं compared to the other before that. This is also the symptoms of the COVID-19, the tiredness. Next is dyspnea. Dyspnea means shortness of the breath. It's not comes in the second day. If the patient having a COVID-19 symptoms, and if the fever and the cough and tiredness occurs till the 5 to 6 days, then it's come along with the dyspnea, like the shortness of breath, then the first thing that strike in our mind is maybe COVID-19. The another symptoms is anosmia. Anosmia means loss of taste. We don't have taste while we are eating something, while we are drinking something, we don't have taste. In this state, we are called the anosmia. Sore throat, definitely. If you're having fever, then the patient complaining of the sore throat also. the running nose, nausea, vomiting when you are eating something. Suddenly after that, we have a vomiting conditions. We are just vomited after the eating something. This is also vomiting sign and symptoms of the COVID-19. Joint pains, as I have some patient from COVID-19, tiredness and joint pain is very common, and the diarrhea. Sometimes the patients comes to, of course, we are living in India, right? If you're having medicine, first thing is come and take a paracetamol, take a something. If the throat pain is there, take azithromycin, and after that we are done with the. If the COVID-19 is occurred, so we have go through the diarrhea also. If the diarrhea happens, the lack of water level in the body, dehydration must be occurred, weakness is occurred, joint pain is occurred. So diarrhea is also the sign and the symptoms of the COVID-19. And suppose that if I am exposure with the some patient, some person who has a coronavirus or who has a COVID-19, so how will we decide कि अब मुझे ये problem हो रही है? So this sign and symptoms is definitely there. And after that, I just want to show the incubation period. What is incubation period of the COVID-19? This is an incubation period. It's called the time after exposure of the any person and before having symptoms. मतलब कि मैं किसी पेशेंट या किसी आदमी के कांटेक्ट में गया, उसके और जब मेरे सिम्टम्स नहीं आ रहे हैं, जब तक मेरे सिम्टम्स नहीं आ रहे हैं, इस बीच के पीरियड, दिस पीरियड इज कॉल्ड incubation periods, and the incubation periods is starts appears in between the second day after exposure and the after and the, till the 14 days after exposure. In between the second to 14 days, these dates it's called the incubation period of the COVID-19. And everything is happened. We know about the COVID-19. We know the signs and symptoms of the COVID-19. We know the what is the incubation period and what. And after that, how will you diagnose the COVID-19 first? We have, for the confirmation diagnostic, we have to go through the diagnostic test. For the diagnostic test, we are doing the two tests, that is RT-PCR. This is stands for the reverse transcription polymerase chain reaction. This is a patient who is suffering for the COVID-19, who has the symptoms. That patient, for that type of patient, we are doing the RT-PCR. We take a throat swab or take a nose swab for the confirmation of this COVID-19. And some patients, in nowadays days, we are hearing about कि उसे तो symptoms नहीं है. I am not asymptomatic COVID-19. In that condition, but he has a history of the contact with the affected person, but he don't have any symptoms. In that condition, we are doing the RT-PCR. That is called, stands for the RT, real-time reverse transcription PCR, polymerase chain reaction. We are doing this test for the asymptomatic COVID-19. Okay. So after the diagnostic test, what all the complications which will happen after the COVID-19 affected cases? I'm going to divide the three categories. The first category is pulmonary conditions, second is cardiovascular conditions, and the third is neurological conditions. These are all the complications. Before doing any treatment, we should know what are the complications. So first, in the pulmonology complications, we should go first is the very common, the pneumonia is very common in the COVID-19, the ARDS. ARDS stands for acute respiratory distress syndrome, and the septic shock for the old age patient and some traumatic conditions also. In the cardiovascular conditions, we are going through the heart failure, endocarditis, that is inflammation in the heart, blood clots in the heart. That's why we are going for the for the blood clots confirmation. We are going the angioplasty, angiography, and arrhythmias. Right? We can say arrhythmias and irregular heart rate. And some patients have a neurological complications. For example, those patients who have in seizures, CVA, that is the cardiovascular arrest, that is, and this stands for stroke also, encephalitis, inflammation in the brain, and GVS, mostly common in the adults in the young age, GVS. Because why is called GVS? Because of in the GVS, some patients suffering from the GVS, because of the COVID-19, the diaphragmatic muscles becomes weak, it's paralyzed, and there is a complication for the breathing pattern. That's why GVS also comes in the GVS in the COVID-19. So we know the complications. Now we are going to treatment protocol. for the medical point of view, we are doing so much experiments, but we still don't know what is a correct treatment for the. We are treating the symptomatic things. If the patient having pneumonia, we are correct the pneumonia. If a patient having ARDS, we are correcting the ARDS. If a patient having CVA, we are correcting the CVA. If a patient having seizures, we are giving to the antibiotic drugs. But we don't have a confirmed treatment right now. Some hospitals doing the plasma therapy, some hospitals giving the antiviral medicine, remdesivir, some hospitals giving the SCQ, hydrochloroquine, but still under investigation, not confirmed yet. But in the COVID-19 conditions, what is our role? What is the physiotherapy treatment for the COVID-19? In this scenario, in this pandemic, I am divided the physiotherapy treatment in 3 parts. First part is intensive care unit setup. That is a ICU setup. The other things, next phase is OPD setup. What we will do with the OPD patients who is a non-COVID patient in this pandemic, how we deal with the patient in the OPD. And the next phase is clinical setups. Those who have a clinics, so how we deal with the non-COVID patients. Even you don't screen the patient, so how we deal with in the clinics for the non-COVID patients. So I'm starting with the ICU setup. See, in the ICU setup, we should know how to hygiene the hand. We should, before doing any treatment in the ICU, we have to wash our hand properly. After washing the things, we have to sanitize our hand properly with the 70% alcohol-based sanitizer. And we should know what is the correct things, what is the correct way to sanitization of the hands. So I'm going to demonstrate with the sanitizer what is the 6 steps of the hand sanitization. First is, if I am taking the sanitizer in our hand, the first step is this one. Next step is in between the fingers, along with the back of the hand on the both side. This is a sanitization process. Even you are washing your hand or sanitization. Third is rub this like this, and the knuckles also, the both hands. Fifth is your thumb, both hands. And the last step is palm, this one. These all the steps you have to perform every time when you sanitize your hands or you wash your hands. In the washing the hands with the soap or some liquid soaps, for 20 seconds is enough. And for sanitization also, not for the 20 seconds, but if it is possible, go for the 20 seconds. The next is, in the ICU setup, we are doing for treatment for the suspected COVID patients or the confirmed COVID patient. So what we will do, whatever you start, first we have to donning of the PPE kit. What is the donning of the PPE kit? Donning stands for the wearing of the PPE kit. I'm going to show you the one video to how to donning with the PPE kit. So please check this out. This is a donning of the PPE kit. First, we have to observe all the PPE kits, like a PPE suit, PPE gloves, your shoe cover, your goggles, your sanitizer, and your N95 mask. First, you have to observe properly, is it all available at the one time or not. This is the observation of the confirmation of the PPE kit correction. You check all the things. And the next is, after checking, all the things, we have to sanitize your hand first. Then after that, you have to go through the first thing is happen, wear the shoe cover first. this is a process of the donning of the PPE kit. First, wear the shoe cover. After wearing the shoe cover, you have to sanitize your hand. See, this is a process of the sanitization of the hand. The next process is wearing the suit cover. Before wearing the suit cover, first is you have to go through the gloves in your hand. This is the first layer of gloves you have there before starting the any PPE kit suit. And this hand gloves is disposable gloves, is not a surgical gloves. Then after that, go through the PPE suit. Somebody will help you out, the nursing staff will help you out for the donning of the PPE kit. You have to do proper. There is no contact with the outer environment. Then after that, wearing the N95 mask. See, this is a process how to wearing the N95 mask. It doesn't mean कि हम सिर्फ N95 mask पहन लिए. This is a correct way to wearing the N95. Before strapping the N95s on your head, you have to seal out. You have to seal your nose on the, that is silver things, and check the complete no leakage is there or not. If the leakage is there, you have to proper seal your mask first. How did you know कि it's sealed or not? When you're taking a deep breath, the N95 mask is inflate and deflate. After that, you have to wear the goggles. Proper check the goggles. In the last, you have to cover your head with the PPE suit. And last, the extended surgical gloves you have to wear. But when you are wearing the gloves, you should know. We should know how to wear the surgical gloves. It doesn't mean कि हम सिर्फ surgical gloves पहन रहे हैं. I am going to demonstrate how to wear the. I have a surgical gloves. I will demonstrate how to wear the surgical gloves. Take it out the surgical gloves. Then always remember, don't touch your outer surface of the gloves. First, you have to go through the thumb area and along with the, and don't touch the outer surface, and then comes like this. This is a step for the wearing the, this is the right hand, and for the left hand, again the same procedure. Wearing the surgical gloves, don't touch the outer surface. First put the thumb and the fingers and done. So this is a outer surface. Don't touch the outer surface of the gloves wearing the things. The next is I think the screen is.
The screen is not visible. So, like actually, while performing your activity, we can't see you, so we can only see the screen. So do let me know so that I can switch
Okay, so
when you are demonstrating. Right.
Okay, I can start again. Not to, I will do it later on. And after that, wearing the surgical gloves, we should go with the auscultation of the patient. We should auscultate the patient properly before giving the treatment, because some patients having the ARDS, some patients having the pneumonia in the COVID-19 condition are suspected for the COVID-19. So we need to know how to auscultate the chest first. I've been giving you the proper procedure of the auscultate with the stethoscope of the chest. So I'm going to demonstrate. Wait.
I'll just stop sharing.
Okay.
Wait. Yes, you can demonstrate now.
Yeah, this is visible, right? Okay.
Yes.
So for the auscultation of the patient, first we have to have a one stethoscope. These are the areas to auscultate the patient. First, we have to wear the stethoscope. Then we start with the upper lobes of the chest. This is the major area for the auscultate the patients. First is this area. The another go for that area. And don't go after first, second. Don't go for this area. You have to come here, middle lobes. Same this side. Again, go for the down, lower lobe. Say back lower lobe. And the next is back of the posterior area of the lungs in the both sides. So it comes like a see first, second, third, fourth, fifth, sixth, seventh, and eighth. Because why am I doing the auscultations? Because if you are treating the pneumonia conditions, we should know where the secretion is more. Then we can give the postural drainage, or we can give the proper treatment of the patient for the faster recovery of the patient. We should know how to auscultate the patient first. And in the auscultations, we should know the sounds of the lungs. That is a wheezes, that is a bronchial sounds, that is a vesicular sounds. In the pneumonia conditions, is very vesicular sound, that is the crackles. Crackle sound is very common in the pneumonia conditions. Even the most common symptoms in the COVID-19, that is a pneumonia, right? So we should auscultate the crackle sounds in the lungs. And again, I'm going to share the screen. So now for the auscultations, we give the treatment. For the chest, we already know. For the chest physiotherapy, we give the percussion and cupping techniques, vibration that comes from the manual vibration or the mechanical vibration. In decompression, this is a techniques we are using the chest physio. The patient who are conscious oriented, are not on the ventilator conditions. We are giving the spirometry exercises. We are giving the spirometry, incentive spirometer, and the Venn spirometers for the faster recovery of the patient. We are giving the postural drainage of the patient. We are giving the postural drainage, which lobe is affected. Then we give the postural drainage positioning. If there are some patients having the ventilator conditions, some patients have a ventilator intubated conditions. If the tube is blocked, we are giving the MHI, manual hyperinflammation. We are doing the suctioning of the patient. The suctioning comes in the two types: open sterile suctioning and the closed suctioning. In the COVID-19 conditions, we are preferably use the closed suctioning because it's the less infected on the outer exposure of the environment. And for those patients who are on the NIV, who are the less non-invasive conditions, not on ventilators, we are giving the mobilizations of the patient. We are trying to take the patients out of the bed, take a walk, take a sit. If the patient on the ventilators, if the patient on the CPAP mode of the ventilators, if the patient having a NIV modes, we give the patients out of the bed. We are sitting the patients on the recliner. So this process is increase the recovery rate of the patient and taking the patient out of the ICU soon. And after all the things, we are also perform the extubation procedure of the ventilators. Some hospitals, they are not doing the physiotherapy point of view, the extubations. but we are doing the extubations. So I'm going to demonstrate one video to you also for the demonstration. This patient is not COVID-19 patients, but I like to show how we are doing the extubation procedure of the patients. So just check this out, the extubation procedure. First, we have to check all the ABG reports, arterial blood gas report, that is a 7.40 or not, the pH level. Then we check start the suction machine. This is a closed suctioning. We are connected the suction with the closed suction and the open suction also. Before doing the extubation, weaning of the ventilator, patient को ventilator से हटाने से पहले हम लोग उसको फिजियोथेरेपी अच्छे से करते हैं ताकि वो अच्छे से wean off हो सके ventilator से. These all the procedures. This is a clapping techniques. I'm doing fast because we're running out of time. We check the power. We ask the patient is conscious oriented or not. We have a cardiac table. After that, we put the ventilator on the NIV mode first, because after taking off the ET tube, taking off the ventilator, we is going through the NIV mode, the non-invasive ventilator. We need the suction done, and then after that, we de-inflate the cuff of the ET tube. Everything is done. Now patient is start again with some physiotherapy over there, chest physiotherapy. We just teaches out the dynaplast and which is stick with the ET tube. It's have to cut the ET tube. Then after that, this removal of the ventilator of the patient. And then de-inflate the cuff of the ET tube. And then after that, we are taking out the ventilator tube from the patient. We put the venturi mask to the patient and ask the patient's name and everything. If the patient is conscious oriented, then we go for the further treatments. So everything we are suction, the oral suction and everything, and then we are taking out the patients on the ventilator. These cases shows us how to extubate the patient. The next is psychological support of the patient. If the patient is suffering from the COVID-19, definitely her attendants or his attendants definitely is psychological depressed. In this condition, you have to give the psychological support. We have to motivate the patient. Don't worry, you will be fine. Nothing to worry. See, before that you are not walking, but now today you are walking. If you're doing the out of the bed, so slowly recovering, taking fast. So not to worry. For the psychological support is very important for the patient also and the attendants also. And the limb physiotherapy must be there if the patient is ventilator or the non-ventilator. So this is a ICU setup for the patient. The same thing we have done with the donning of the PPE kit. We have done with the extubations. And the next is doffing of the PPE kit. How to take it out the PPE kit. This is very important because after that you are going to, first we have to sanitize your hand. Remove outer gloves. Take it on in the yellow dustbin. And then after that, taking out the suit. This is very important. Don't touch the inner outer surface of the PPE suit. This is very important because after that, you are going to the home, you are going to some area. So you don't touch the outer surface of the PPE suit. This is the most important thing you have to do. See, this is rolling out. So avoid the touching of the outer surface of the suit. And then put it in the yellow bin. Always remember, put in the yellow bin, not in the blue or red bin. and then after that, and again sanitize the hand and taking out the shoe cover, and after that the N95 mask, all the things which is done in the first. We have to lean off for the removal of the N95 mask. Don't touch the outer surface of the mask and put it in the dustbin. Then perform the sanitization for the 20 seconds. So this is all for the ICU setup. And now patient comes with the OPD setup, right? If the patient comes to you in the OPD, if the patient is not COVID patient, the patient having back pain, PIVD concern, frozen shoulder concern, neck pain concern, in this pandemic, how we deal with the patient in the OPD setup? Because in the now this scenario is done कि यदि मैं hospital जाऊंगा तो मुझे कोरोना हो जाएगा. This is the most things is happening right now. In that condition, how we'll do? If the patient in the OPD, patient comes to you in the OPD, the first thing, all hospitals already screened in the entry gate if the COVID-19 or not. The first we will do in the OPD setup, detailed assessment of the patient. In detailed assessment, we have to go through the travel history. You don't have a travel with the out of the country or some other areas. COVID contact history, COVID contact person history. Use the PPE kit. In this condition, use the head cap, use the gloves, use the shoe cover, use the goggles, but don't use the PPE kit suit because it is uncomfortable doing the mobilization and anything. So use the disposable apron while treating the patient. Ask the patient to wear the mask because we are treating the patients, non-COVID patient. Patients should also wear the mask before during the treatment. Hand sanitization of the patient and doctors also. Sanitize your hand also, give the sanitization to the patient also before treating the treatment. Check the temperature before starting the treatment because some patients tell a lie also because he's suffering from another pain, back pain, severe back pain. He can tell a lie कि मुझे कोई fever नहीं है. It's your duty, check the temperature first. Take a history of the cough, cold, fever. Changing gloves for each patient. If you are taking the gloves for the one patient, take it out and change the gloves for the another patient. Psychological support. Definitely psychological support motivate the patients. Take the awareness of the what is the COVID-19, what is the myth about the COVID-19, and the frequent hand wash. If you are a clinician, you have to wash your hands every half an hour. So this is a OPD results you should follow in the OPD in this COVID pandemic. And those patients and those doctors who have a clinics, the condition scenarios something changed. Those doctors who have a clinic, first we have to, before entering the patient, check the temperature. You should not go out of the clinics and check the temperature. You should appoint someone to first check the temperature, take a history of cough, cold, fever, and the travel history of the patient. There's some reception area or somebody appoints somewhere on the clinic's door. So he take the history, temperature check, and the person belongs to which zone. We are all government designated the orange zone, containment zone, red zone, green zone. We should know which zone the patient comes from. Ask the patient and attendant to wear the mask while entering the clinics. Hand sanitization of the patient and the attendants. Here is attendants also. Hands should be sanitized. When the patient enters your room, take a detailed assessment. Again, the PPE kit for the doctors. The next is social distancing in the waiting area because governments allow us to maintain the social distancing. Even this we should follow our clinics also in the waiting areas to maintain the social distances. And fix the appointment for every patient. Give the designated time for every patient to avoid the rush in the clinics. Do the proper sanitization of the clinics. You should follow the 2 to 3 times the complete sanitization of the clinics and the modality or the operators of the clinics. Surface cleaning, especially on the waiting areas and the reception area, surface cleanings. Attendant distance. Some patients comes to you, some patient come comes to you for and asks you something, the attendant asks you something, you should maintain the distance with the patients. So you should follow these things. Psychological support definitely it comes here. Psychological support, you should give the psychological support to the patient also. And this is the three criteria for the ICU setup, OPD setup, and the clinical setup in the physiotherapy point of view. In the last, what you will do and don'ts in the COVID-19 pandemic. Do's is do take precautions, do exercises in the lockdown conditions in the home, do maintain household hygiene, or the sanitize your handrails, handrails of the door, handrails of the trees, and do eat and hydrate. Proper eating and proper take water. Do get sun exposure. Do the sunlight because vitamin D is also necessary. Do stay occupied. Do something in the home. Don't get less occupied because खाली दिमाग शैतान का घर कहा जाता है. And do sleep well. Obey the rules and do stay empathic with the doctors and the policemen and the other housekeeping staffs outside of the hospital and the area also in the society also. Don't just comes with the don't step out unnecessarily. Don't let your hands wander. Don't overdo binge watching. Don't have late dinners. Don't resort and panic buying. ऐसा नहीं कि कल से लॉकडाउन हो गया तो आज ही सब सामान खरीद ले. Governments provide us the lots of things. We are doing the proper grocery for the our homes properly. We have enough resources for the grocery things. Don't believe in rumors and myths. Don't take alcohol or smoking. Although governments allowed home delivery also, but you should avoid alcohol. And don't drown in dystopia. दिमाग में negative things नहीं आने देना है. Don't isolate your mind and don't feel hopeless. Don't feel hopeless, man. If COVID-19, most of the people saying this is a war and we have to win this war. But I don't think this is a war. This is a given situation. So we have to deal. We don't have a treatment for the COVID-19. That's why we are doing the experiments. So this is not a war. This is a given situation for the mankind. Definitely we'll find it out some treatment for the COVID-19. So don't be hopeless. Be strong. Even I'm going to share the one experience because I've also treated the COVID-19 patients in my hospital. I have done the 7 days COVID-19 postings and I exposure with the COVID-19 patients. Even that is in that experience, I feel during the treatment and during the things, I feel nothing. After 7 days of total complete duty, even I can't come to the home. The hospital sent me for the 14 days quarantine for some other places. I have resident blue. I have gone to the resident board 14 days. Even 14 days is okay, but after the 14 days, that is not about after 14 days. After 13 days, 14 days, you have the test for the COVID-19. They took the test from your swab, throat swab or nose swab, and after that, I am telling you why I am experiencing these things. जब तक टेस्ट आपसे ले लिया गया, स्वैब आपसे ले लिया गया, और जब तक आपका रिपोर्ट नहीं आया, till your reports awaited, this hour is very horrible. Mentally is very depressed. माइंड में आता है कि क्या पता पॉजिटिव हो गया है तो पूरे घर ही को क्वारंटाइन हो जाएगा, पॉजिटिव होगा तो क्या हो जाएगा. Lots of negative things. In that condition, as a healthcare worker, we should be strong in that conditions, not to worry if it's positive or negative. यदि पॉजिटिव आया तो क्या हो गया भाई, अच्छा काम के लिए तो पॉजिटिव आया, नेगेटिव आया तो इट्स ओके. Unfortunately, my test was negative, and after negative test results comes, again back to the hospital. I'm doing the job over here. In the last, first thing is that you have to save yourself first. Then you have to protect the other persons. It's called in a Hindi also, हम सुरक्षित तो जन सुरक्षित. यदि हम सुरक्षित होंगे तभी हम जनता को सुरक्षित कर सकेंगे. So this is our saying, हम सुरक्षित तो जन सुरक्षित. And this is I am to finish my COVID-19 presentation. Thank you so much. Thank you so much for sharing all the things. Yeah. Is it visible,
right, Prashant sir?
very well
Yes, yes, yes.
so much.
Thank you so much. It was really insightful.
Thank you so much.
Thank you so much. And now I would like to invite Miss Anam Jilani. So she'll be speaking on how to achieve nutrition during lockdown for all age groups. Ma'am, all over to you.
Hello.
Yes, ma'am. Ma'am, please go ahead.
Yeah, good afternoon, everyone. I hope everyone is at home and safe. Um, Let me just share the screen first.
Right.
Yeah, I just want to bring the basic things and basic outline of the situation currently going, as Mr. Prashant has already described in elaborate way what is COVID-19, what is coronavirus. But I just want to know that among this 152 participants, I am so grateful to everyone who has given me time out of their Netflix and all that period studies they are going through. But I just want to say one thing, that as Modi ji has brought to a light that everybody should follow the Ministry of Ayush guidelines which they have provided us with, in which they have also said that everyone should be well informed of basic things which they can do staying back at home. Because COVID-19, as everyone knows, that there is no cure. But following the few nutritious guidelines, you can just help yourself and your body to immune yourself and boost your immunity so that you can have an ability to fight against few virus, few infections. And I'm sure that everybody is well aware of that what should be done, because now it's been almost more than 2 months. Everybody is staying home, everybody is watching TV and news. Basic measures are all being described and written over the screens. But again, for a better information, I'm just bringing in everything here. And I have written everything on the slides, but still to just elaborate few, I just want to say, everyone just please control over your weight. I have come across many people who was calling me and asking, okay, please help us with good nutritious recipes, because sitting back at home watching Netflix, we are just gaining weight. So the humble request I will make to everyone is, please watch your diet. It is the time which has made us well aware of that we should be really, really thankful to God that we are healthy. We have all the available sources and we can afford all these sources and we can keep ourselves healthy. Sitting back at home also, we can, look after our diet and we can manage everything, and we can just do little if buts to just make our body fight against all this thing which is happening outside the door. The basic thing I will say is everybody must have seen their grandparents consuming Chyawanprash. Now here comes the role of Chyawanprash. I'm not saying Chyawanprash is a tasty thing, because everything which is healthy is not tasty. I agree, but consider it as an immunity booster. So just try to purchase a normal Chyawanprash and try to consume that 1 teaspoon in the morning. It is very good immunity booster. And I think everybody at this time has understood the importance of health. And everybody is very much aware that if they are healthy, they can survive. Secondly, people, you must have heard your mother, or if there are some elderlies also, they must have heard that golden milk. Golden milk is haldi ka doodh. Everybody who used to get fall when they were young, unko maa bolti thi कि हल्दी का दूध पिला दो. If they are not well and they fall sick, हल्दी का दूध पिला दो. What is हल्दी का दूध? Nothing but immunity booster, because it has anti-inflammatory, antibacterial property. So turmeric is a very good thing to consume. I'll not say consume it every day, because once you start, I'm sure as if you consider it as a golden milk for yourself, you can consume it every day, but at least consume it within like with a gap of 2-3 days, but make it a habit of consuming it. And I will suggest that every day in the morning, if you can go, if you start with your day with a warm water, then go with the Chavanprash and give a gap of 2-3 hours, and you can then go with the golden milk. Now, second, if you have a dry cough and sore throat, which many people might be having, please don't just judge it that there will be something abnormal with the cough, because it is normal to have a normal cough at this time also. But as Dr. Prashant has said, कि अभी बहुत ज़्यादा डर बैठ गया है सब में, ज़रा सी खांसी आती है and they are scared. Don't get scared, it is very normal. And it's okay if you have a cough, but if you have a cough and it is dry and you don't feel something is really painful and something is really extreme, please have a steam inhalation with fresh pudina, which is very much available in your kitchen pantry. You can have the long with honey, and everybody knows this also, that long in honey concoction is very good for throat irritation. Now, everybody is aware of food handling, which is like everybody is saying, keep yourself, sanitize your hands after every half an hour, 1 hour, 2 hours. But if you're at home, I would suggest that you're not going out. So sanitizing yourself every half an hour is not important. But sanitizing your food in a way that cleaning your food, fruits, vegetables, and your pulses, your rice before cooking is very important. Normal days also it was very important. Now it is more important, because now you cannot take any risk with the food. Because what you consume is what is reflected in your health. So keep your hands, kitchen and utensils clean. Now you have too many products to sanitize your kitchen and utensils. You can purchase that. If not, normal water and baking soda makes a very good cleaning agent, for which you can clean your kitchen and utensils both. If you have raw fruits and vegetables, except those which get spoiled with the water, you can just wash them with normal warm water, and you can keep it in an open air for at least 5 to 6 hours before actually consuming it. And like banana and all, which you can't wash, you can just expose it to open air for 5 to 6 hours before consuming, because you can't wash banana. If you wash banana, then obviously it's going to get spoiled. Now comes your raw meat. If you're consuming raw meat, if you're getting raw meat from the market, my suggestion would be, as soon as you get the raw meat, please get it, unpack the raw meat, wash it very, very nicely with the cold water first and then with the warm water, because if you use high temperature, obviously meat is not consumable and you can't store it. You have to cook it immediately. But if you have to store it and consume it later, then you have to wash it properly and just keep it in a very good Ziploc bag and store it in a refrigerator. Wash your hands before handling the meat and wash your hands after handling the meat. Now comes that what should be consumed to to boost your immunity is, obviously everybody knows that kalonji. Everybody have kalonji in their kitchen pantry. Some who are not handling kitchen, it's okay, you can go and ask your mother. And I think many of them who are attending, they know what is kalonji. Kalonji is a very good immunity booster. It is not a medicine to treat coronavirus. It is a general thing which I'm sharing it, and many might be knowing it, many might not know it, but I'm just sharing it that kalonji has too many benefits. The first benefit, if I collab with Dr. Prashant, is that it is a very good thing which can help the inflammation of joints. If you have inflammation or pain in joints, you can just make a kalonji oil, which I have just shared the screen, in which it is written that you have to use kalonji oil 1 teaspoon with equal parts of honey in 1 cup of vinegar, and make it a paste, and you can give this to your dadi, your dada, or anyone who is suffering with their joint pains or something. Second benefit, because it has good fatty acids, potassium, amino acids, iron, sodium, it is a powerhouse. So it is essential for maintaining the overall health. But when it comes that how much it should be consumed, I will suggest you just take a box of kalonji in which you have stored it, and just take a pinch. Now, whatever amount is there in your pinch, just consume it with water, and that's it. You don't need to chew it properly. It is okay. You just have to consume it with 1 or 2 times you can chew, but not that you have to make it a good powder inside your mouth. You can just consume it with normal water. Then comes the best food buys. These are few guidelines which has been laid by WHO, and WHO has recommended. Now these are some standard recommendation being given. It's not necessary that everyone should go through it. Obviously age differs, so consumption also differs. But these are general guidelines. Now, everybody knows vitamin C consumption helps in boosting your immunity. This is a perfect time. You get oranges, grapes, you have all the fruits in the markets. Consume them. They will help you in boosting your immunity. The only thing I'll suggest throughout the slides will be immunity boosting. And that is very important. That is the only guideline I'm following, because you can't get a cure of corona. The only cure I can suggest you is stay home and eat healthy. These are few things I have noted on my slides. Frozen fruits and vegetables, I don't know, WHO has recommended that they are good options, but I still suggest that if you go for the fresh one, they are the better one, but you need to wash them properly, because they say that they are cheap, but if I consider the Indian market, frozen vegetables and fruits, they are not cheap here. So I still say that rather than going for an expensive buy at this tight time, I will suggest go for the fresh fruits and vegetables. They'll be really helpful. Now comes the dried and canned pulses. Dried and canned pulses can be consumed and they can be bought outside from the market, because there are certain salads which are really good. You can search, you can go through Google now. Everybody has, what I have made out after watching all the videos, everybody has become a good cook now. In this COVID time, everybody has become a chef. Their real chef has come out because they've got a lot of time to spend in the kitchen. So they can try good salads, and good salads are possible with, obviously with canned, they are much easy to make, and you really don't need special guidance in that. You don't have to cook, you don't have to be a little cautious it is overcooked or undercooked. So you can go with the canned one. Now comes the whole grains and starchy roots. Whole grains, I'll suggest everybody sitting back home are consuming maximum junk. In spite of restaurants being shut, the home delivery is still on, but people are not actually consuming a lot of outside food. But I've seen people making all those kind of pizza at home, pasta and everything. It's okay, once in a blue moon, it's okay. But consuming it every alternate days and very frequently, it is really going to affect your health, because everybody knows that wheat is okay, but nobody likes whole grains. Nobody will prefer to go with multi-grain bread than white bread or atta bread, because obviously it tastes better. But I would suggest there are many options now in the market. You can go with brown pasta, brown rice. They're very good. Go and consume them. Try learning new recipes out of them. They have a better shelf life also, and they are very good at your health also. They're not going to affect your health. Now comes your starchy roots. Starchy roots is potatoes, sweet potatoes. See, sweet potatoes are very good source of fiber. Then potatoes, because yes, potato, everybody is not comfortable. They really don't want to put on weight. So I think once in a while, sweet potato salads, and just grill sweet potato and sprinkle some chaat masala and lemon juice, and it becomes a very good salad. You'll enjoy. Second comes your dry fruit, nuts and seeds. Again, I have already told you that this is something which is not new to everyone. Everybody knows consuming the nuts and dry fruits. They are very good for your health. Now is the time to really understand the importance of each and every food which is getting into our mouth. Don't eat to satisfy your mood. Eat to make yourself healthy. There is enough time to get happy, but you can stay safe, healthy and happy if you have a good health. So try to consume something which is going to boost your energy, your health. Consume badam, 2 badam, 1 walnut and 2 cashew with few raisins. This will become almost not a bowl, but half a bowl. Consume that early morning. Early morning means not obviously utte hi aap nahi khaoge, but at least before consuming the breakfast, go for the nuts. They are a very good source of energy. You will get fiber also, you will get good fats also. And these are the fats which are really good for your health. Now, here I want to bring to a notice everybody who is consuming the nuts already, they should be aware that nuts should be unsalted. Don't eat too much of salted nuts or sweetened nuts, because obviously then their nutritional value will be decreased. Consuming a lot of salt and sweet is obviously not good for health, and especially at this time, you should be cautious of salt and sweet. Now comes the egg. Egg is, again, everybody knows it's a wonderful source of protein, and you should consume, at least who are vegetarian, they can consume a boiled egg once a day. It is really good for health, and just try to use it without oil. So poaching of egg is preferred than frying. It will be good for your health also, and I'm sure with time you will start enjoying it. Everybody who's missing the gym must be missing the diet, which your trainer must be suggesting you to go please with the eggs. Now comes the canned vegetables. Canned vegetables, as I've earlier mentioned, that if you are a good person who enjoys salads, these are a very good options. Like personally, I have 2 kids at home, and making them happy plus serving them nutritious food, it's really a big task. But what I have learned that these canned vegetables, they are very good source of, eyes. Serving your food, it is more important, you need to satisfy their presence. So you have to get them, cook them, and see yourself that you will be impressed looking at it. Mushroom, spinach, peas, tomatoes. See, tomatoes, I'll suggest don't get canned tomatoes. A very nice thing I'll suggest you, get tomatoes from the market, fresh red tomatoes, wash them properly, and keep them to dry in the sense, just dry them the water with which you have washed. And once they're dry, just pack them in a Ziploc in a refrigerator. Why I'm saying this? Because in refrigerator, if you store the tomatoes, they'll, after a certain period, they will get ripe and they will get overripe. So don't store them in refrigerator, rather than store them in a freezer. In freezer, if you store them, the perfect thing you will notice is once you want to use the tomatoes, take the tomato out of the refrigerator, it will be the color of the tomato, the red color will be intact. You will enjoy chopping it because it will, the water will not spill all over, the seeds will not flow out of the tomato, it will not be squishy. So you will enjoy cutting it in a very good shape. This is what I'm sharing my personal experience, what I'm doing right now. Secondly, if someone is non-vegetarian, you can consume fish, but again, just be very cautious in from where you're purchasing the fish, because fish is a very good source of protein, everybody knows, but it is also a very good source of infection also. You can get bacterial infection from it, fungal infection, because you don't know from where you are carrying it and how the people who's supplying the fish is handling it. So it is better if you consume the canned fish, and canned fish are available in the market in oil. Then comes the reduced fat shelf stable milk. What we meant to say by this is consume the milk which has a less fatty content. You can go with the toned milk. It is a good source. Everybody can get milk easily. Milk is in a very essential product, and it is something which is very much available to everyone. During this lockdown period, milk is the only product which is not being hindered by any kind of lockdown or anything. Lastly, I just want to say to everyone, wanted to know that is there a particular food with which they can stay safe and they can stay healthy? There is no one food which can give you complete nutrition. There are few things which you have to make concoction of to make it a complete source of nutrition. I have mentioned here spices, which everybody in Indian kitchen, at least everyone has these spices: haldi, zira, dhania, and lesun. You must have seen too many Ayurvedic people must be suggesting a kara. Yes, it is a very good thing to drink. It is not a cure of coronavirus. Again, I'm mentioning nothing I'm suggesting is a medicinal effect to coronavirus, but it is again just to boost your immunity and protect your body from anything you can fight. That is the basic idea of that your body can be healthy and you have an ability to fight. So drink this kara, which you can make from tulsi, dalchini, cinnamon. I think if you don't know the Hindi name, you can just take the English. I have quoted with English names also. And lastly, I just want to say, please sleep on time. Everybody, I'm sure they know that sleeping patterns are disturbed a lot during this lockdown period, because some are watching Netflix late till night, some are playing, some are doing different stuff. But again, I just want to say that sleeping pattern also directly affects your health. There are few hormones which are secreted in your body, like example, melatonin is a hormone which will only be secreted once you're in darkness. And when you're always viewing your mobile and or your TV or anything, your laptop, your brain knows that you are exposed to a light. So melatonin will not be secreted. It has a direct effect to your health. Now, obviously, if you sleep late, you'll wake up late. And this pattern is going to affect the overall health. So if you're consuming good food, but your habits are not good, so you can't keep yourself, or you can't put yourself in a healthy person. Healthy person and healthy lifestyle requires both eating healthy, staying healthy, and following healthy habits. If someone is in a habit of smoking, please quit it. Someone is in a habit of drinking, please quit. At least now it's a high time to realize that our health is the utmost important thing in our life. We can give up everything, and we have given up everything, be it cinema, shopping, and friends, friends in a way, dining out, meeting them out. We have given up everything. Ultimately, what we are more worried about is our health. So I request everyone, eat healthy, but plus inculcate good habits in yourself, in your surroundings, and in your family. Ask everyone to just help you out in, inculcating good habits. Sleeping early, waking up early with our family, going for the yoga in the open balcony or terrace or anything, because these are the few things which will keep you engaged. Now, everybody knows that exercise is good for health, but I don't know how many of you are exercising, because initially everybody was enjoying the lockdown. Now, as it is increased, everybody is too upset. Okay, we want to step out, we want to go here, everything is locked, we are tired of watching TV. Now what should we do? Lockdown is no fun. We are not sitting at home because we have been given a punishment. Rather, we are protecting ourselves, we are protecting the world from this virus, this monster which has entered the world. And we should just pray that everybody should be safe. And I suggest everyone to please stay home, stay safe, and wish you a very healthy life. Thank you so much. Over to you, Gaganji.
Thank you so much, ma'am. Thank you so much, ma'am. It was really insightful. We got a lot to we got a lot more knowledge on how to keep ourselves healthy and what all diets we can take during the lockdown, right? So thank you so much, ma'am. So I would request Prashant sir and Anam ma'am to please come on platform. Ma'am, I hope you can come with your video on. We can
See, I think you have not
take
given me the
some live
authority of.
questions.
Can you please give me the authority of starting up my video, because I'm unable to start my video. The host has disabled it.
So
now I'm on live. Yeah, should I answer
right,
the few questions which has been put it up for me?
Sure, ma'am. We'll be going one by one. Actually, we will be starting with the questions for Prashant sir. We started with that. So we have first question coming from Simon. So the question is, how can we increase immunity to fight COVID-19? Is there any exercise you can recommend? So you're on mute. Can you please? Yes.
It is audible now?
Yes,
Okay.
it's audible. Yes.
So in the point of the COVID-19 for the exercises, the mostly exercises which comes for the fitness things, fitness point of view, right? Like in these conditions, in the lockdown conditions, the person who is not having the COVID-19, for that thing, we have go through the fitness level. We will do the yoga things. We are doing the yoga like a pranayam and anulom vilom. And of course, with the same things, we have to increase the lungs capacity. Lungs carrying capacity to oxygen. That is the deep breathing exercise, thoracic expansion exercise. If it is possible, by the spirometry, and do the exercise with the spirometry. And along with the same thing, we are doing some extending exercise of the knees, especially for those persons who is having the knee pains, history of knee pain, osteoarthritis. We are doing the static quadriceps. For the frozen shoulder, we will do the normal range of motion exercise of the shoulders. For the back extending exercise, do the core strengthening exercise of the back, and along with that thing, we will do the stretching exercise for the fitness point of view. For the immunity point of view, we will do, mostly we are doing for the fitness point of view. We are not doing, no exercise will increase your immunity. If you are living in a home for the long period, we should increase the stretching size, increase better, keep maintain the muscles quality, keep maintain the joints quality, improve the lung capacity. You are not exposing of the sun, the vitamin D deficiency. They maybe cause those person who are suffering from the vitamin D deficiency. We should do some exercises like stretchings. Those person who are in back pain, do the back extending exercises. These exercises we can maintain the health in the COVID-19. Thank you.
Right. Right. And so the second question is from Shivangi. She's asking, will yoga be helpful to enhance the immunity? If yes, how often should we practice yoga?
Definitely. We'll do, in the yoga point of view, we'll do the Anum Jilani and the stretching size, the pranayams, and the some different asanas. So increase the immunity also, and you can maintain the fitness level, and of course the mental peace. Of course, the yoga is the very good thing in this scenario.
Right. And so there's like one question is quite famous with the US President Donald Trump also. Like, what is the role of hydrochloroquine phosphate in COVID-19?
See, it's all about the hydrochloroquine. This is the one scenario, it comes in the hydro SCQ. Some hospitals, in the right now, what scenario going on in the Delhi, in the hospitals, right? For the safety point of view, what the hospital administration do, they give the hydrochloroquine medicines for the staffs of the hospitals.
Right.
These are preventive measures to avoid the COVID-19. They give the SCQ medicines to the staff कि आपको ये मेडिसिन लेना है, ठीक है, आपकी मर्जी है कि आप लेना चाहें या ना लेना चाहें. But most of the staff, because of the fear, they took medicines, but it's a criteria. First you have to do in a one day 200 mg, next day 400 mg. It's a protocol to take a hydrochloroquine, the first dose, second dose, third dose, and fourth dose. But the main thing is that the disadvantage, the adverse effect of the hydrochloroquine is the abdominal discomfort, shortness of breath, nausea, headache. So we should avoid hydrochloroquine. Even for me, they recommended me also who took the hydro, but I didn't take the hydrochloroquine. But it doesn't mean कि मैं hydrochloroquine नहीं लूँगा तो मुझे COVID हो जाएगा.
Okay.
Also in the trial basis. So I recommended कि those who want to take, go ahead. Otherwise, okay. Even I talked to some medical practitioner who are giving the SCQ. I just asked them, sir, is it relevant? The SCQ is helpful to prevent the COVID-19. He just said, okay, ठीक है, चल भी सकता है, नहीं भी चल सकता. This is a 50-50, but I don't think, even personally, I didn't take the SCQ.
Right. So there's one question from Kumar Abhishek Jha. So he's asking, suppose a patient on mechanical ventilator, which mode is best to give chest physiotherapy management and why? Okay. And benefit of ambulation in ICU setup for COVID-19 patient.
This, I think I gave the answer of this thing because it's a quite vast answer, right? So first we should know, for this answer, we should come for the starting things. First we know what is the setups of the ventilator. If the patient comes to me in the emergency, not physiotherapy, is the secondary consultant of the any patient, not the primary consultant of the any patient. If the some patients come to the emergency with the COVID-19 combination or suspected, with the having breathlessness, difficulty in breathing, so we are putting the patients on the ventilator with the ET tube that comes with the mouth, through the mouth to the lungs. That ET tube we have seen the ventilator support. So in that condition, we are giving the volume control. We are giving the 100% O2 to the patients, and we are giving the mechanical ventilation to the patient, inspiratory and expiratory. Then the patient becomes stable. We send it to the ICU. ICU on the not from the shifted from the emergency casualty to the ICU team. In these conditions, for the maintenance of the patient respiratory system, we have to put it in the pressure support mode, not a easy support mode. We will give the pressure support PS mode. In this condition, that is the PRVC mode. In this condition, now physiotherapy comes in the role in the patients comes to the ICU, then it's patients in the PRBC mode, pressure regulatory volume control, or CPAP mode, or the patient is non-invasive or NIV mode, then you can start with the physiotherapy and all. And after in the patient is PRBC mode, we are giving the
Right.
physiotherapy in the PRBC mode, and slowly we are taking out the ventilator. So there is a steps PRBC, then come to the SIMB, then come to the or SIMB or CPAP mode, and then after the extubation, that is the weaning of the ventilator, put the NIV, BiPAP, and the patient on the nasal prongs or the oxygen level face mask. This is the protocols for the giving the ICU setup physiotherapy. And the point of the why forcing the maintain the out of the bed to the patient, because it's also gives the confidence levels of the patient. If the patient, suppose that I am COVID-19 patient, I have gone through the patient for the long period, bedridden patients. Definitely, मैं अगर मुझे 10 दिन से 15 दिन से मैं बेड पर लेटा रहूंगा, तो मैं definitely weak हो जाऊंगा. Definitely
Right.
we are already bedridden patient. In that conditions, we are trying to make the patients out of the bed. It's also increase the lungs capacity. It's also increase the confidence level of the patients. It's also increase the mobility of the patients. So this is very helpful for the patient point of view also. Thank you.
Right. Right. Anam ma'am, I hope you're online. We can't
Yeah.
see you actually. Okay. Sam, there are a few questions for you as well. Again, Abhishek is asking, like, my question is on importance of vitamin D as a diet in current situation.
See, vitamin D as a diet in current situation, vitamin in whole, like vitamin D in whole, and in every
Right.
situation it is important, because
Okay.
the best role of vitamin D is obviously making your bones healthy and strong. But comparing it and considering it as a precautionary precaution for coronavirus, there is no direct connection. Exposure to sunlight, consuming vitamin D supplements, anyhow, every day it is important. Every lifestyle needs, every person needs this in normal life also. But directly, I think you can go through Google also. There are no direct history related that vitamin D consumption can cure coronavirus. But don't consume everything just to prevent yourself from this virus. Just consume
Okay.
normal vitamins normally also, because they will boost it. They will boost your bone health.
Right. Right. And ma'am, there's one question. Okay, there's a number over here. So this is one of the attendees. He's asking, what role water and hydrates play in fighting coronavirus?
There was a study which was done that coronavirus water is can play some role in preventing you from coronavirus. No. Again, I'll say, as earlier someone has asked, vitamin D, same, water and hydration is important in every day and every person.
Right.
So you should consume more water. It is going to prevent you from, getting dehydrated, getting you infected, and, preventing you from getting weak. Because if you are well hydrated, you will not feel weak, you will not feel hot, you will not feel that my skin is getting dry. Rather, you're getting indoor, you'll not be exposed to sunlight, but you need hydration. It is very hot outside, it is very hot inside. Nobody is sitting 24/7 in a AC. I would suggest that hydration is anyhow important for maintaining your good hydrated cells. So water, your body is made up of 70% of water. So water is anyhow important, not a diseased person, but for normal person also. So you should consume more water, and try to consume 8 glasses of water. Don't count it, but I'll suggest keep 1 liter of 3 bottles, and try to make it a habit of consuming those 3 liters of bottle every day. If you can do that, increase slowly.
Right.
It is very good source of losing weight also. If somebody was asking me, it is good for losing weight. Yes. Consuming more water, yes, you can lose weight because you will feel less hungry, but it doesn't mean that you should not eat at all.
Right. So I'm with losing weight. Preeti is asking, is it good to lose weight with dieting and not exercising? It's like question from
No,
everyone actually
it's not.
nowadays.
It's not.
Right.
If you ask a nutritionist, it's not. But if you go to a gym trainer, I think some of them will suggest, okay, don't do exercise, go on a keto diet. But there are certain, side effects of keto diet also. Please don't consume anything and everything which you can see on Google, because different bodies, they react differently. So if you are sitting at home, you really want to be a lazy bee, please don't go on dieting. Dieting is not a cure. It is rather going to be a precursor in making you more immune to problems ahead. So please avoid getting into some trap of infection or disease. So rather just eat good food, nutritious food, and please avoid dieting. Dieting is not a cure for anyone. Consume a good nutritious food. That is, I think, a better way of helping your body to fight against anything and everything.
Right now. And ma'am, like now we are coming up with this question from Devita Jain. She's asking, are ashwagandha and giloy good for boosting immunity, especially during the ongoing pandemic?
See, again, this is an Ayurvedic medicine, which is, I think, I have not consumed it personally, but I've heard that people who are fighting with stress, they consume this.
Okay.
It helps you in fighting stress. And because of this pandemic, many people are, suffering with anxiety, stress. But I would again suggest never consume these supplements without taking prescription or taking suggestion from the doctors, because, okay, fine, they're herbal, but they might be having some effect if you are consuming it every day, because you're not aware of how much quantity you should eat and how much you should, for how long you should consume. So I suggest, whether it's herbal or it's homeopathy or it's Ayurvedic, whatever the medicine is, you should always consult a doctor before consuming it. Because I would rather not allow anyone to just eat and start eating anything. Chawanprash I can, because it is something which is being tried and tested, and it is being followed by our great grandparents. They consume it. We know that it is going to help in boosting our immunity. But considering it for a particular cause, like it will relieve your stress or not, I cannot really suggest just to consume it without any suggestion from or consultation from a doctor.
Right now. Ma'am, just like last 4 questions we'll take and then we'll wind up. So there's a question from Abhishek. As I experienced, Kalonji oil is not good for hypertension patients. So how would you
No, it is not.
suggest?
It might have been bad for someone, or it might have not suit someone, but Kalonji in itself is a very good source of it contains lot of antioxidants. And antioxidants can never be harmful for an hypertension person, because it is said a person who's suffering with any heart diseases should be consuming more of food or stuff which is, contains more of antioxidants. And what is the role of antioxidant? Fighting against those harmful radicals. But it might have reacted somebody, and if it is reacting some person particularly, I'll suggest that you should go and ask the doctor. And if they suggest not to eat, you can stop. But you can go through Google. You can have a quite long, detailed information on Google, in which it is said that Kalonji is very much safe and consumable by hypertension patient also and hypotensive patients also. Because it also helps in lowering your blood glucose level, cholesterol level, plus it also helps in boosting your immunity, because it is very high on antioxidant. So it can't be harmful, but maybe somebody must have reacted to it. So I'll suggest they can stop it and they can ask the doctor for the detailed information.
All right. Ma'am, Prashant sir, I hope you're there. We lost you in between. You're on mute also.
I'm here.
Right. So maybe this question is for you. Are antibiotics effective in preventing or treating COVID-19? This is a question from Jyoti.
No, I don't think so. We are still under investigation about the medications. I don't think any antibiotic medicine is helpful for the COVID-19 because there is no treatment for the COVID-19. We are only dealing with the symptoms of the COVID-19.
Right.
For the
Right.
any kind of things, for suppose that we are having a pneumonia kind of thing, we are giving the medication according to the pneumonia. So I don't think there is any antibiotics for the COVID-19. There are antibiotics for the symptomatic things like pneumonia, ARDS, any bronchitis, anything. It depends on the conditions.
Right. Right. Anna ma'am, a question from Nikita. She's asking what is the best way and time to take Kalonji?
See, I have already suggested the best way of consuming it is just take a box or wherever you have stored the Kalonji, just take a pinch. Put your 2 fingers inside the box, take a pinch, and whatever amount has been there in your pinch, just consume it with water. The effective time, I don't know really. I can't relate it scientifically, but what everybody I have seen following and I personally am following is early morning without consuming anything. The first thing I do is after brushing my teeth is the consuming of Kalonji with honey. I don't take it with water, I take it with honey. So it makes it little tasty and acceptable by the, by our tongues because we need everything tasty. So I consume it early morning. First thing is Kalonji with honey. A pinch of
Right.
it.
Right. Right, ma'am. Ma'am, the last question for this webinar. So can you suggest some effective way to correct sleep cycle? So many are consuming chamomile tea also for sleep, and you might be knowing about it.
See,
So
if
please.
you are fine and if you're not dealing with any, sleeping disorders, which are like medical attention is needed on that condition, that if you're fighting with some sleeping orders, you should consult the doctor. But if you're asking this for a general person, like people who are more prone into watching the TV, videos, YouTube and everything at night, the only thing is, if you want a healthy lifestyle, I think it is not a very tough thing to adapt a good sleeping pattern. Everybody knows that few things is done for yourself. We are someone who can only guide. We can give you good suggestions,
Exactly.
but adaptation and following is a person's, it is their choice. If you want to stay healthy, you want to follow a healthy lifestyle, I think it is not difficult by anyone to adapt a good sleeping pattern. And good sleeping pattern can be adapted. That I have few suggestions that if you really fall or your parents, they have difficulty in following asleep, there are few natural way of making them, sleepy is consuming a warm milk at night.
Right.
Can help in falling you asleep. They, applying the olive oil in your foot, warm olive oil, can also boost your sleep. So there
Right.
are few things you can do, you can adapt in your daily lifestyle. And please stop viewing TV or screen at night. Because once you start something or you start watching a movie or something, it is very difficult for your brain to give you a signal it is a time to sleep, because melatonin is in, I'll suggest it is an hormone which helps to give your brain a signal that it is a time to sleep. But if you
Right.
don't give a darkness to your brain, the hormone will not be secreted, you will not fall asleep, you will not get a signal from brain it is a time to sleep. So stop screen viewing more at night.
Right. Right, ma'am. Right, ma'am. So with this, we are done with our Q&A session. It was really insightful, and thank you so much, Anam ma'am and Prashant sir, for taking time out of your busy schedule. Because with this, we can this
It
is the
was a
best
boost
way.
to ourselves, because getting engaged through these webinar, it is good for both the sides. We get to
Yes.
get aware of few things which we are not aware of, and we get to ask good questions in which our memory is also refreshed.
Yes, exactly. So, ma'am, just for the closing session, can we have all panelists, Dr. Monica, ma'am? So we can just start with you. If you can have a closing comments from your side.
Thank you, Anam and Prashant. It's been a
Thank you,
pleasure. I've not taught you as a student, but having alumni on the portal, changing the seats, it's always been a pleasure. And I feel students are able to connect better with the alumni because they relate better. And your experience and about COVID and physiotherapy and nutrition has been very well. And we hope to have more webinars with our alumni because the connection is better in future. And thanks a lot, Colonel Sanjeev and Dr. Bushra. And yes, Dr. Bhavna has been wonderful. I've been pushing her for all this work, and she had been wonderful helping me out for arranging this webinar. All the attendees, the students, and the alumni who have joined us, thank you so much. And thanks a lot, WAF team, for such a wonderful arrangement of the webinar. And hope to have more such webinars from the alumni in future also. Take care. Thank you.
We are honored. I'm just for the closing thing, I'll just request Dr. Bhavna, Dr. Sanjeev, and Dr. Bushra just to give like half a minute for closing session. So can we start with Dr. Bhavna Sharma?
Yeah, sure. Thank you, Gagan. And first of all, thank you, Monica ma'am, for having it on the platform. It is good to connect with the old students, but without your push, it won't be happen. So thank you so much, because I'm new to the organization. So it is really a pleasure, and the warmth from your side, it was really good. And Supriya ma'am, of course, backbone of this, who is
yeah, I miss Supriya. Yeah, thanks to Supriya also.
So obviously, because without her guidance, so nothing would have been possible. Knowing the structure and environment, she is best who can guide, right? And obviously Sanjeev sir, who has initiated all this. So, and Prashant and Anam, really thank you. I have not been your teacher, but it's been great connecting you both, and looking forward for more webinars too. And WAV team, definitely thanks.
Actually, the world is here.
Yeah. I'll request Supriya ma'am and Sanjeev sir and Bushra ma'am to give few words for them, for the students attendees also.
Who's next?
Yes, sir. Please, sir.
We can start with Sanjeev sir.
Okay, it's a wonderful session. I must congratulate the organizers for a beautiful session, and the alumni, all the students of School of Allied Health Sciences who participated in this, and especially the speakers. My special congratulations to Anam and Prashant for very lucid talks. I must say that you are very well fitted into your teacher's shoes. You'll do much better in life, and all my best wishes are with you. I must also want to announce to you that School of Allied Health Sciences has started PhD in most of the subjects. So those of you who want to continue further studies, they can come back and check up these things, and can start your doctorate. We have started in almost all subjects, barring one or two which were started 2 years ago. And to take this opportunity, and we are also in the process to have some kind of refresher courses for our alumni. If they want to refresh something, of course they can come for 2 or 3 days, have formal or informal get together and learn the few procedures from their teachers. What are the new things have come up, and all those things, they can refresh everything and meet everyone. And
Really
this bonding can increase, because after all, it's your alma mater. Keep in touch with it, and it's great having you over here. Thank you so much. All the best.
Now,
Yes, Bushra, please go ahead.
thank you, everyone. This webinar is very nice. Actually, Anam is my student, and I'm very proud for that. She speaks so well, and I feel like this is my first batch which is passed out. So I am very proud of that. She has done a good job. And Prashant also, you also had speak very well, and we are very thankful to you both and all the students who had joined here. And we are very much pleased to offer these kind of webinars once again, because this will give us very good information, and we came to know that our students are of that capability. And I'm very much thankful for this. And I'm thank you for this, because you are my first batch, and I had a special attachment with you all. They are 10 and all are very good.
Thank you.
Thank you.
Right. Thank you, everyone. Just before closing, there are two announcements. After this webinar, you will be redirected to a feedback to our survey website. Please go ahead and help us with your valuable feedback. And also, you might have seen a message from Dr. Bhavna Sharma that she'll be sharing a feedback form to all the attendees through mail. So please do help her with the feedback as well. Right. So with your permission, can we conclude this webinar?
Yeah.
Yes, before that, Supriya ma'am, if you're here, please, I would like to have you.
I don't think so. Ma'am is in the
Yeah,
list.
maybe
No,
because
ma'am.
she's having too much of network issues. She's
Okay.
messaging in between. So yeah, for on her behalf also, Prashant, thank you. And everybody on the panel, sir, ma'am, and team Vav. I think I've already said so much before. So thank you from her side also. Looking forward for more. Yeah,
Right.
thanks.
Right.
From my side also, thank you, Gagan. Thank you so
Right,
much.
sir. Right, sir. Anytime, sir. Like we are always there. We are honored to have this session for Sharda University.